Have you ever asked yourself the question, why does my knee not bend after total knee replacement surgery? Does it just not add up? Does something not make sense for you? Hey guys, my name's Tony Maritato. I'm a licensed physical therapist and I run the Facebook group, Total Knee Replacement Support Group for kind people. Feel free to come check it out. But I want to talk about this topic. If you followed any of my YouTube videos, you know that I recently had a new patient in the clinic who had a manipulation under anesthesia. It was his second manipulation under anesthesia. And he's an amazing guy. He is working harder than anyone, trying to gain his range of motion. He's a young guy, otherwise healthy. And it's one of those situations where we have to ask ourselves, when something doesn't add up, when something doesn't make sense, we have to ask ourselves, what we're missing. What did we miss in this situation? And so in his case and many other cases, you know, I see individuals that I am fortunate in that I'm a physical therapist and I get to see hundreds of people after a total knee replacement every year, probably thousands over a 20-year career. And with that, I can tell you that very rarely, very, very rarely, do I ever see somebody who I genuinely think is not doing enough. And most of the time, when that does happen, it's usually because of poor pain control. But in general, most of the patients that I see who are struggling to gain range of motion are doing just as much, are working just as hard, are trying to push themselves just as aggressively as the person next to them who has no trouble getting their range of motion. And so I know conventionally we always say that scar tissue is forming, that we're going to do a manipulation to break scar tissue. And I've seen videos and I've been involved with manipulations where in the procedure room you can hear what sounds like a ripping, a tearing noise. And so that, I believe, adds to the idea that we're breaking scar tissue. But I would say when I ask a question and I get the same answer and the answer doesn't make sense, I have to ask a different question. So is it possible that there are other things at play here? Is it possible that there are other reasons that the knee won't bend or won't go into full extension? Now, some patients, absolutely, it's a pain problem. When I'm working with a patient in my clinic and I'm trying to bend the knee and the knee is kind of stopping, before I get to the end range of motion, I know that that stopping is a reflexive action on the person's behalf because it's getting painful. And if somebody is pushing you into a painful position, you're going to resist. Whether you want to or not, the muscles are going to protect and guard and stop the motion. That's what we call an empty end field in physical therapy. But that's not always the case. So we could genuinely have scar tissue. We could genuinely have pain restricting motion. I believe that there's issues with swelling. Certainly we see those knees that are red and swollen and dark and warm to the touch, and they're just not going to go through the range of motion, even if there is no scar tissue restricting them. As you flex a knee or extend a knee, that fluid has to move, and so as that fluid is pressing against the connective tissue structures, that could be enough to trigger the brain to stop movement. So my goal in sharing this video is not to say that I have the answer, because I certainly don't. If I did, I would be able to help a lot more people. My goal in sharing this video is to simply say that the 1, 2, maybe 3 most common answers that people, healthcare providers will give you for why your knee isn't bending, those probably aren't the only 3 answers. There are probably lots more reasons. There's lots of different kinds of tissue, from bony blocks. Sometimes I have patients who during flexion will get a bony block. We believe the top of the tibia or the prosthesis is pinching against the hamstring tendon or some of the structures in the back of the knee. Sometimes there is a Baker cyst back there that might limit full terminal knee extension. So there are lots and lots of reasons why the knee won't bend. I just want you to know that scar tissue formation probably is not as popular as we assume it to be. And while it is certainly frustrating for you, the patient, not to get the range that you want, and you know that the surgeon is expecting you to do it, at least know that your therapist should know that you are doing as much as you possibly can. And sometimes doing less is more. If you haven't seen my other videos about doing too much, go check it out on the channel. But I can tell you that I've worked with lots of patients that were just pushing themselves too hard and they didn't give themselves a day or two of recovery. So you know how much you do in a 24-hour period. Sometimes taking a day or two off, you're not going to lose any of the progress you've made in 24 to 48 hours, but it might just be enough to allow you the recovery you need to then push ahead and get to that next goal level. So guys, if you have questions about anything, absolutely let me know. I'll catch you on the next video.